Hi everyone. As promised, this is just a quick video on how to do the nose to tail health check that I handed out on Sunday. If you haven't got one of these, let me know, I'll print you one off. Or if you've got any questions afterwards, you know where I am. The more often you can do these things, the happier and more comfortable your dog is going to be in having them done. You're not going to need to do this whole setup with the treats and things like that. You can if you want, but it's better if you just incorporate these kind of things into your habitual interactions with your dog. So your dog will just get used to it being done. When you give your dog a scratch, have a quick feel for ticks. When you give them a fuss or a cuddle and things like that, just have a look in their eyes, flip the tongue, flip the lips, have a look at their gums, things like that. Your dog will get used to it then, and it'll just be the norm. So that way when you go to the vet and the vet has to do a health check and the vet wants to check all these things, your dog will just be completely used to it and will actually might enjoy it even. So I'm going to go through this start to finish, but again you can if you want, but you don't really have to. I'm just going to show you what to do. So I've got my tub of treats there to keep her occupied and to keep her happy. I'm just going to go and get my assistant. So anyone who's never met Nessa, this is Ness. Hi, Petal. Yes. So see, I've already just done nose. She put her nose up to me. I can see her nose is wet, as Nessa should be. Your dog's nose might naturally be dry, and that's okay if your dog's nose is dry. Your dog's nose is dry, but you need to know if there's a difference. So if your dog's nose is usually dry, and suddenly it's wet all the time, that might indicate excessive licking, something like that. If your dog's nose is wet and then it's suddenly dry, that might indicate a bit of dehydration, maybe, or an upset stomach, something like that. So anyway, Nessa's nose lovely and wet. Hi. Yes, there you go, Rocky, you can have one. Good girl. So all you do to check the eyes is just lift up the eye like that a bit, and you just see that the sclera, the white part of the eye, is white. Little red veins in it. If that's gone completely red, really dark pink, that's when you need to maybe have a bit of a think that there might be something wrong. I can see her pupils, yes, are lovely and clear. She's getting a bit old now, so they might. No, they're okay. So, there's no discharge in the nose, there's no swelling in the nose, and the nose is dry. Eyes, there's no discharge, there's no swelling, clear and bright, sclera colour as I've just described, the pupil size is fine, she doesn't seem irritated when I touch them, she's not rubbing them on things all the time, so we're good there. Mouth, again, no discharge, no swelling, I can feel her teeth through her lips. Gum colour is nice and pink. I don't know if you can see that from there. I'll put up some pictures actually to show you what white gums look like, what healthy gums look like, and what red gums look like. So just so you know what to look for. Her teeth are nice and clean. They are cleaned regularly with dentist sticks and a bit of a scratch on some excessive plaque sometimes. Is a good girl. Yes, she is. I know, yes. Isn't it fun? Yes. So there you go, I've already done nose, mouth and eyes. Ears, and Nessa is having a bit of trouble with one of her ears at the moment, but an easy thing for the ears is as you're giving a fuss, just stick your thumb in, have a bit of a wiggle. Most dogs quite like it, and then you have a look. Thumb is dry, yes, that's out your ear. There's nothing there. This side, there probably is going to be a little something. Yeah, just a little bit of discharge there. Oh, yeah, that's horrible, that, isn't it? But we're dealing with that. We're cleaning her ears. We're aware of that there's a problem there. But just to have a look in, you just flip the dog's ear back like that and have a look. Good girl. See, she's completely used to it because I do this 3-4 times a week. With her, we actually do it every day because we're cleaning her ear out at the moment. And it's lovely and clean. Nice pink colour. There's no smell, it's all in there, there's no discharge, there's no swelling. They're the key things to look for really, is discharge and swelling, but there's none of that. This side, same again. Again, there is a little bit of discharge there because we're going through a bit of an ear infection thing with her at the moment. It looks just a little dry and crusty. That's the bit that we're cleaning. So if you see that bit of dry, crusty, yellowy kind of stuff, it might not be an issue. Just give it a bit of a clean out. There might be something in there. If you need to do that, let me know and I'll show you how to clean the ear out. But really, you should just pop the vet and have a look. Chances are your vet will just charge the consultation fee, which I know is a lot at the moment, but you could just give it a clean with maybe a damp tissue or a damp cotton bud. If you're going to use a cotton bud, you should always be able to see the tip. Never put the tip of the cotton bud so far in somewhere that you can't see it anymore. If you're doing that, you're poking too far. You should always be able to see the tip of the cotton bud as you're having a clean. That's actually not too bad today, is it, pal? I know, yes, yeah, good girl. Yeah. So it says on here, clean pinner. I think you might be wondering what the pinner is. This is the pinner. Just the flappy bit with all the folds and stuff in there. Just again, as you fold that over, you can see straight away. That one's lovely and clean. That one's a little bit crusty. So you'll be able to see the difference there. I know, yes, it's annoying, isn't it? So next one on the list is paws. Again, swelling and injuries. Who's a good girl? So you just rub your dog's paw, and I can feel all the bones and that in her foot. Who's a good girl? There you are. I can feel the toes. Claws need a trim petal, don't they? So I can see there's no swelling there, nothing like that. This usually works best if the dog's on their back. Lie down. There's a good girl. So the dog on the back, I can immediately see all the parts. So as she's getting a belly rub, ain't you? Oh, she likes her belly rub. I quickly have a look at all her pads. There's no redness. She's got black pads anyway, but look in between the toes. There's no redness, there's no swelling, there's no foreign bodies. Quite often you'll find a grass seed or something like that during the summer might get stuck just here. Just pull that out, give it a rinse, give it a wash or something like that, that should come out. While she's on her belly, on her back rather, having her belly rubbed, I'm feeling all her mammaries here because she's a female. And then her belly and all her bits. There's no swelling, there's no redness and things like that down at her bits. And her bum is clean. Marvellous. That's what we like to see. In it, pal. Yes. So I'm kind of jumping around the list at the moment because of where I've got her and what I'm doing. Oh, is that good girl? Yes, is that good girl? So we've just done paws and claws. They do need cutting. Surrounding fur is okay. She's not excessively licking. There's no staining. There's no ball patches, things like that from excessively licking. Dogs lick their paws, they do. But some dogs will do it quite obsessively and they'll turn, so the white fur will turn brown. They might even get ball patches. You don't want that. If that's happening, there's something up. Okay, so the next one, skin and coat, flaky or red skin. We can see from here, her belly. That's Nessa's natural colour. Strange little, looks like she's filthy, but she's not. Again, that's knowing the norms of what your dog is. So her skin is lovely and clean and clear. There's no red patches, there's no ball patches. I'm not seeing any signs of fleas. There's no strange smell. She hasn't got the right coat for knots. But if your dog's got a slightly longer coat, especially one that's got to be brushed or one that's got to be trimmed on a regular basis, just keep an eye out for knots. The worst place to get a knot is around the joints and around the ears. The backs of the ears are quite often missed more than you'd think. So make sure that if you're looking for knots, make sure you go behind the ears. Body, lumps, bumps, swelling and sensitive areas. Sensitive areas means there's nowhere that I can touch her that she flinches, that she's not happy for me to touch. When you start doing this with your dog, there'll be plenty of areas that, oh, I don't like you touching me there. But as the dog gets used to it, that should be all right. So she is used to being touched and prodded and poked and manhandled and that. So if I got to a place where she's suddenly flinching, I know that there's a problem there. What else have we got? No swelling, sensitive area. Bums and bits, we've already done. There's no discharge, there's no swelling, there's no Klingons, pooey bits on a bum or anything like that. Her anal glands, Nessa's don't need doing. Jake's do on a regular basis though. You might want to go to the vet and just have that one checked. If your dog, or they say, oh yeah, it needs doing, I'd suggest learning how to do it. If not, oh no, they're perfectly fine, then I wouldn't worry too much about it. Like hers, I know hers are going to be fine. Hers never need doing. Fecal consistency is key to your dog's health. If your dog's got diarrhea all the time, it might just be that that's how your dog is. If your dog's usually got really good solid shaped poos and all of a sudden it's squirting out, that suggests a problem. And again, if it's too dry, if they're really struggling to get it out and it's coming out like stones, there's a good chance there that there's a bit of dehydration maybe, or there's something a bit more serious going on. And urine colour, it's something you can't really go and check, because more often than not they pee in the grass, don't they? But if you can just maybe have a quick peek while your dog's having a wee, that would be very beneficial. We've caught a couple of bladder infections by doing that. Just watching as they wee, and either the very beginning or the very end of the wee, if there's red, if there's blood, then that's usually a signal that there's something up, something's not quite right, and you need to get the vet straight away. Not straight away, but make an appointment as soon as possible. So I think that actually covers everything on the list. Again, if you can just incorporate this into your daily fuss and your daily routine. I know she loves having her ears rubbed and stuff like that. Ticks. Actually, I didn't cover ticks, did I? Flaky red skin, fleas, overknots, borders, clean skin folds. She hasn't got any skin folds really, but if your dog has got a lot of wrinkly skin, just make sure that you stretch them out, pull them apart, and make sure that they're not red and sore inside. I've missed ticks. I can't believe I've missed ticks. Right, okay, so looking for a tick is easy. It's just this. Just when you give them a fuss, when you give them a rub, behind the ears is a big one. Now I know Nessa's got just a little skin tag. That's all it is, just behind her ear there. Every time I feel it, I think tick. It's not tick. But if you feel a lump behind your dog's ear, about that big, if it's any bigger, then it's been there a while. But it should just feel like a skin tag, like a little Rice Krispie stuck to the skin. Around the ears, just at the ear entrance here and behind the ear, they're the most common places. Here, just behind the elbow in that joint there, and here, just at the front. Stand up, pal. There we go. Also here, in there, and on the inside leg. Occasionally you might get them up the backside, but you can get them anywhere, literally anywhere, right across the back. So we give her a nice scratch, and while she's getting a scratch, I've got all 10 fingers there searching, looking for ticks. I know, because I do this on a regular basis, many times a day. She likes a nice scratch and that, don't you? So I just take the opportunity just to make sure that I know my dog's skin, I know my dog's body inside and out, so that if I ever do this and suddenly there's something there that wasn't there yesterday, I know that's a problem. It just needs to be looked at. It might be nothing, but it could be something. So yeah, there you go. Who's a good girl? Yes, kiss. Good girl. What a good girl. Yes, you are. To know your dog's respiratory rate and heart rate is very important. Given a size, and again, the individual dog, I know that Nessa's heart rate should be around about 70-ish. About 70 BPM. So what we do, the best way to check is in the inner thigh. You feel that there's a muscle there, and then you go back and there's a bigger muscle there. In between the two muscles is a bit of a dip. Just push your fingers into that dip. There it is. And then you time that for 15 seconds. So I've got 18 there. That's perfect. Yes. He's a little bit anxious because of what's going on and it's a little bit weird. So it's a touch high, but it's within parameters, isn't it, pal? Yes. And your breathing rate, it's best to test it when your dog's asleep. When your dog is just lying there, fast asleep, just watch how many breaths your dog takes within 15 seconds, and again, times that by 4. I've left a little bit down the bottom there for you to write it down so that you don't forget. And then you can put this somewhere until you get used to doing all this or what have you, and until you commit those figures to memory. So over the next few weeks, what you're going to want to do is repeatedly take the pulse. Usually when they're resting, if you can just go over while your dog's asleep, hi, you're alright, and just slip your hand in and take the pulse while they're asleep, you can't get a better resting heart rate than asleep. Right, thanks for watching everybody, and I shall see you at the pack walk. Hiya.